Hi guys, welcome to my channel. So today we will be discussing about the blood donors and their types. Okay, so we'll begin with the topic. So there are various types of blood donors, mainly classified as allogenic donors and the autologous donor. Allogenic is further classified as voluntary donor, replacement, professional donor, directed donor, or apheresis donors. Then voluntary donor. Voluntary donor is a person who gives blood, plasma, or other blood component of his or her own free will and receive no payment either in the form of a cash or in any kind which could be considered as substitute for the money. So there are three category of voluntary donor. First is a new voluntary donor. A voluntary donor who is a non-numerated blood donor who has never donated before. So they can also called as first time voluntary donor. Lapsed voluntary donors are voluntary non-numerated blood donor who has given blood in the past but does not fulfill the criteria for the regular donor. Now, what is the criteria for the regular donor? And it's a regular voluntary donor. So, a voluntary non-remunerated blood donors who donate blood on a regular basis without any break for a longer duration between two donations. There is one family or replacement blood donor. So this type of a donor is a member of that family or it's a close friend of the patient who donates the blood in replacement of blood needed for that particular patient without involvement of any monetary or other benefits from any source. Then there is a one professional blood donor which is banned in India and 1st of January 1998. A donor who donates the blood in exchange of money or other form of any benefits or payment. Then there is a directed donors. Directed donor is a donor who is a family member or a friend and is of a same blood group donate blood for that specific patient. So this patient blood will go to that specific patient. Then the types of blood donation. So the types of blood donation includes your autologous donation when the person is giving blood for himself or herself, then apheresis donation, whole blood donation and the directed donation. Now the apheresis donation is again classified as platelet pheresis, plasma pheresis, leukapheresis, double RBC pheresis. Next one is your autologous donation. So it is a donor who is donating blood for his or her own use. The indication is the elective surgery. What are the contraindication? If the person is having unstable angina, recent MI or cerebrovascular accidents happen, cardiac or pulmonary disease, there is untreated aortic stenosis, symptom of cardiac and pulmonary disease without treatment. Now, what is the advantage of this type of a donor? So there is a decreased risk of disease transmission first, then the transfusion reaction risk is decreased, risk of alloimmunization is decreased. But there are certain disadvantage with this type of donation is bacterial contamination, circulatory overload, cytokine mediated reaction, and it is a expensive procedure as well. Now your donation is again classified into four types. First is the preoperative collection, second is acute normovolemic hemodilution, third is intraoperative collection, fourth is a postoperative collection. So preoperative collection, that is the blood is collected prior to anticipated need. Perioperative collection and administration. Then acute normovolemic dilution means the blood is collected at the start of the surgery and then infused during and after the procedure. Intraoperative collection, that means the shedded blood is recovered from that surgical field or the circulatory device then infused. Then as last one is a postoperative collection. The blood is collected from the drainage devices and reinfused to the patient. Next is your how we can do the pre-operative collection. So pre-donation usually begins 4 to 5 weeks before the surgery and it depends how many units is required for that surgery. Usually one donation per week is done. In 5 weeks we can have the 5 units of blood. So to prevent the anemia in such type of donors during the donation, iron tablets is prescribed to them, and there is no special complication to the pre-donation. Vasovagal reaction can be observed, but no treatment is required. The time interval between the last donation and the surgery should be more than 72 hours. And the technique which is used for such type of donation is also known as leapfrog technique, which is used 4 to 5 units of blood required pre-operative blood donation, and it's stored in a liquid state. Next one is your acute normovolemic. But before that, we have to look into the what are the indication of preoperative autologous donation. So these include your major orthopedic surgeries. More commonly, we can use such donation for hip and knee replacement surgery, cardiovascular surgeries, obstetric surgeries, radical prostatectomy, mastectomy, or some gastrosurgery. Now, what are the exclusion criteria? Who cannot donate such type of donation? If the hemoglobin is less than 11, or the scheduled surgery to correct the aortic stenosis, or there is uncontrolled hypertension, MI, restrictive obstructive lung disease, impaired renal function, coagulation disorder, active bacterial infection, or there is uncontrolled seizure disorder. Acute normovolemic hemodilution, it's referred to the removal of the blood from the patient immediately before or just after the induction of the anesthesia. That is at the time of the surgery we are doing it. And it is replaced with the fluid. So no pre-donation is required in this technique, and the loss of the volume is replaced by the crystalloid or the colloid. If you are using the colloid, then the ratio will be 1 is to 1. If you are using crystalloid, then the ratio is 1 is to 3. The amount of blood collected, it depends on the patient estimated blood volume, preoperative hematocrit, and the lowest hematocrit desired. Collected blood can be stored at the room temperature for 4 hours, or for 24 hours we can store that blood at a temperature of 1 to 6 degrees Celsius. Then the blood is reinfused in the reverse order of the collection. So the first unit which we have collected will be transfused last, and the last unit which we collected will be transfused the first. Then what are the advantages? It is a simple and less expensive than the other three techniques. Provide the fresh whole blood for transfusion, no biochemical alteration associated with the storage, and the removed blood is kept at the room temperature, so there is no chance for the hypothermia. Platelet function is preserved, no reduction in the oxygen capacity reduction in the oxygen carrying capacity of RBC. RBC loss during surgery is less because it is dilated with the fluid. Hemodilution decreases blood viscosity, which improves the tissue perfusion. So it is possible for the emergency surgeries. But there are certain contraindication if there is anemia, severe coronary artery disease, severe pulmonary dysfunction. Through it's rare, but there are chances of complications, decreased renal function, carotid artery disease, MI, or cerebral hypoxia. Then intraoperative collection. So the collection of the shredded blood from the surgical site. It is collected and it is processed through the instrument, which will wash it with the saline and remove the debris, free hemoglobin and plasma. It will concentrate the RBC to a hematocrit of 50 to 60%, and then there is an infusing of those cells immediately. What are the indications? Cardiothoracic surgery, orthopedic surgery, cardiac surgery, liver transplant. We can use such type of collection, but there is only one contraindication, that is contamination with the urine or feces can happen. What are the advantages? Pre-operative donation not possible, then we can use such techniques. Misidentification of blood product decreases. There is a chance of urgent surgery. Disadvantage is high cost, experience personal, quantity of the blood collected is less. Next one and the last is the post-operative blood collection, the recovery of the blood from the surgical drain, which is followed by the reinfusion with or without processing. The shredded blood is collected into the sterile canister and reinfused through the microaggregate filter. Recovered blood is diluted, it is partially hemolyzed and defibrinated, and it may contain high concentrate of cytokines. Upper limit on the volume is 1400 ml of the unprocessed blood can reinfused. Transfusion should be done within 6 hours of initiating the collection. Infusion of potentially harmful material in recovered blood like free hemoglobin, red cell stroma, fat, toxic irrigants, tissue debris, fibrin degradation, activated coagulation factor, and complement. So most common it is seen in the orthopedic procedures such as hip or the knee replacement. Advantages include low cost, avoid need of allogenic blood transfusion, misidentification error decreases. Disadvantages, the amount is very less. It can cause the transfusion reaction due to the presence of the cytokines, fibrin degradation products, and sepsis in the donor. Next is apheresis. So this is the collection of a specific component and while returning the remaining whole blood component back to the patient. So platelet pheresis means we are collecting the platelets and giving back blood and other components back to the donor. So we have to check veins during the physical examination. Platelet count should be above 1.5 into 10 to the power 3, and there is like one SDP is equal to 6 RDPs, and the interval is like twice per week or 24 times a year, and there should be a gap of 48 hours between the donation. There should be gap of 48 hours between the SDP donation. Donor reaction can also occur. It's because of the citrate or the anticoagulant. Routine procedure takes 40 minutes to 1 hour. It depends on the equipment what we are using, and you can store that product for 5 days on platelet agitator at room temperature, that is 22 degrees Celsius to 24 degrees Celsius. What are the indication of it? So thrombocytopenia, aplastic anemia, bone marrow transplant, these all are the indication for the platelet pheresis. Next one is your leukapheresis. So it's a removal of leukocyte with the return of red cell, platelets, and plasma back to the donor. So it is required for treating the sepsis. Granulocyte concentrate must contain minimum of 10 into 10 to the power 10 granulocytes with a shelf life is 24 hours. Granulocyte collection yield by the apheresis procedure, it can be increased by giving the steroid, addition of red cell aggregate agent, which include your HCS, that is hydroxyethyl starch, which is a common sediment agent. It enhances separation of WBC from RBC during the centrifugation. There is a disadvantage like it's a colloid, so it can expand the donor blood volume and it remain in the circulation for longer time. Next one is the corticosteroids. It Corticosteroids, they are believed to increase the vascular pool of the granulocyte by stimulation of bone marrow to increase the cellular output to the blood. So what steroids can be used like corticosteroid, prednisolone, dexamethasone, these steroids can be used. Growth factor, these are the newer agents. These are the recombinant hematopoietic growth factor which can be used, and they will produce 4 to 8 times volume of the cells compared to the other agents. Next one is plasmapheresis, the collection of the FFP. Now these can also be donated twice is a week or one donation 48 hours apart from the another one, and donor must be tested for total serum plasma protein levels, quantitative immunoglobulin level, and the protein electrophoresis. It is a procedure in which the whole blood is drawn from the donor or the patient, anticoagulated, separated into the component, and return of the separated cellular component back to the donor or the patient. If relatively small volume of plasma are removed, then it can be replaced by the saline, and therefore the term used as plasmapheresis. Last is double RBC pheresis. So in this, a donor is giving the 2 units of red cells at the same time. So donor keep their own platelets and plasma and get additional saline compensation to make up for the blood volume loss. Donor must wait for 16 weeks before the next RBC donation. For females, the height should be 5 by 5, and for males, the height is 5.1. So, if we are taking two RBC donation or the whole blood donation, so which is beneficial? So, let's look into it. So, in double RBC collection, they will only donate the red cells, and the volume is 400, and there is a saline return of 500 ml. Whereas in whole blood donation, the donor is donating red cell plasma platelets 500 ml, there is no saline return. Thank you everyone, and kindly like, share and subscribe the video.